Here.
Is it?
No, ma'am. Not
Yeah,
clear.
there's a little bit of static in there, Swati, but that's
Oh,
okay.
okay. Okay, Dr. Sachin, then we can start.
Thank you, Swati. Can everybody see my screen over there?
Yes, sir.
Okay. So good evening to everybody in India, and thank you for staying with us this late on a Sunday. I will be moving track from clinical neuro-ophthalmology, which I love to discuss, to another topic that I love even more than clinical neurology, and that is education. So today I'll be talking about some of the NANOS initiatives in education, particularly novel. So the learning objective is to review development of online multimodality educational curriculum. And all of you have taken the first step, or rather several steps, by attending all of these webinars over the last couple of years. So before I start, there are a few terms that are important in digital learning. What is a learning object? A learning object is any grouping of materials that are structured in a meaningful way and tied to an educational objective, which is a learning objective. If there is no learning objective, you get a collection, which is just a grouping of various materials. And the materials or assets are individual items. For example, it can be a video, it can be a document, a picture, a simulation. You saw several of those in the presentations today. It can be stored in a digital format, which is why it's called digital learning. And a curriculum is a course of study or syllabus, which means it's a sophisticated blend of educational strategies, course content, learning outcomes, learning experiences, assessment, the educational environment, and the individual student's learning style, all put together, knit together into a single plan, and that makes it a curriculum. Novel started as a project which was grant funded by the National Library of Medicine and was pioneered by Dr. Kathleen DeGray at the University of Utah with Nancy Lombardo, who is a librarian at the University of Utah back in the early 2000s. And over the course of several years, a strong partnership was built with NANOS. So what is Novel? Novel is Neuro-Ophthalmology Online Virtual Education Library. It's an open access repository or collection of digital materials, all pertaining to neuro-ophthalmology or other allied specialties. It has been used for educational and research purposes, and currently we have more than 18,500, closest to 19,000 learning materials in this collection. So recollect, I'm using the word collection at this stage. Novel is spreading across the globe, and last year we had about 19,000 unique visitors to the website who viewed close to 350,000 learning materials over the course of the year. So this is the website. It's novel.utah.edu, and I'm going to take a brief tour of it with you. Hope you guys can see the screen. Let me know if you cannot. So when you go to the Novel website, this is the home page, and it's a very easy navigable website. So you start with the home page, and if there is a specific topic that you want to learn, you can click that topic over here. If there is a specific format that you prefer, like image, video, or any file type, you just click on it, and then you search. And it will come up with a listing of various topics related to that particular subject. And so it is a collection that you can access. So this is one of my students who actually produced a learning object, and I'm going to run it for about a minute or so for you to see what kind of materials there are.
Hello, my name is Justin Grassmeyer, and I'm a student at the University of Nebraska Medical Center. This presentation will cover optic tract syndrome. Here's an outline of what we will cover. First, we will define optic tract syndrome. Next, we will describe etiologies of optic tract syndrome, a typical patient presentation, and then correlate clinical findings with the pathophysiological mechanisms of the disorder. Optic tract syndrome refers to the dysfunction and degeneration of the neurons involved in carrying visual information via the optic tract. The anatomical course of the optic tracts is shown by the illustration. These fibers are composed of retinal ganglion cell axons traveling to the lateral geniculate nucleus of the thalamus. Each optic tract carries fibers that originate from both the left and right eyes. Retinal ganglion cell axons originating from the temporal retina of the ipsilateral eye, and axons originating from the nasal retina of the contralateral eye that have decussated at the optic chiasm compose each tract.
So you can see that the videos can target a wide range of learners and can be used in various learning formats. So back to the PowerPoint, and hopefully you can still see it. Interrupt me if you cannot. The next concept that I want to introduce to you is the neuro-ophthalmology curriculum. So we have to build a plan that can be used by our learners to learn a specific topic. And so in 2005, Dr. Valerie Buse, who was the curriculum chair at that time, developed the first NANOS neuro-ophthalmology curriculum, which I and my team updated in 2020 with all the newer advances that have taken place in the last 15 years. The curriculum was published in the Journal of Neuro-Ophthalmology and is currently used as a standard national curriculum for training of fellows and residents in the US. And for everybody, you can actually access this on the Novel website. So here is the link. If you go to the Novel website and click on curriculum, you should be able to see it. So this is the NANOS curriculum outline. You can see the whole curriculum is listed out here, and you can see some numbers in parentheses next to each topic, and we will go and see what those actually mean. So the curricula has been designed for different types of learners, whether you're a neurologist, an ophthalmologist, an optometrist, an ophthalmic technician, orthoptist, allied health, neurologist. So depending upon who you are, you can tailor the curriculum to your needs. The numbers that you saw in parentheses refer to different learner levels, which means, are you a beginner or a student? Are you an intermediate level, which means you're a resident? Or are you advanced in your ophthalmology, which means you're a fellow or a practitioner? We also design curriculum with other specific tasks in mind, such as examination techniques. And finally, over the last few years, we have partnered with a publisher called Teton Data Systems to collect and marry the various objects that are located on the Novel website with the NANOS curriculum to create the illustrated curriculum, which means every learning object is now linked to a specific part of the NANOS curriculum itself. So what are some of these products? The biggest one is the Neuro-Ophthalmology Illustrated Curriculum, which highlights the up-to-date version of the curriculum and links learning objects to it. A couple of years ago, we came up with the next, which is the Neuro-Ophthalmology Examination Techniques, which deals with the various methods that are used in neuro-ophthalmology for eliciting clinical signs and symptoms. And over the last couple of months, Dr. Carl Golnick led this particular project, which is NOTE, Neuro-Ophthalmology Techniques of Examination for the non-neuro-ophthalmologist. And the non-neuro-ophthalmologist can be a physician in other specialties, or it could be allied health personnel like nursing staff who frequently do eye movements and pupil checks on their patients, occupational therapists or physical therapists who have to deal with patients with vision loss, or your ophthalmic technicians in your office. So these can be accessed through a health services library. In the US, the library gets an access to these. We are currently in negotiations with Teton Data System to see if these can be made available to an international audience as well. So how can you use this resource in your own teaching environments? Clinical needs are busy. Clinicians are getting busier and busier, and leaves us with little time for any formal teaching in the regular hours. So you could go and give a lecture and then ask your students to go back and use the learning digital content on novel to augment classroom teaching. You could use the novel objects while you're doing your lecture or bedside teaching to emphasize a learning point. For example, if you're talking about nystagmus, there are plenty of videos highlighting the various types of nystagmus, and a visual representation is often useful to make a point. In the US, we use a flipped classroom method, which is very effective, which means you assign your students a topic that they need to read ahead of time. And the next day you can do a group discussion. For example, you can have your students review optic neuritis the day before, and you can present them various cases and you can discuss that. You can provide alternatives to learners with different methods. Some of us are visual, some of us are auditory, some of us are practical. So no matter what an individual person's learning strategies are, you can use it. And most importantly, as I said, you can customize to a learner's need at any particular level. Lastly, I want to highlight the fact that Novel is a crowdsourced resource. If you have a neuro-ophthalmology, an orbit, strabismus case, consider publishing it in Novel. There is a list of gaps that you can go to the Novel website, and you can review those. So this is how you submit. There are instructions over here. There is a gap list that we update every month. You can look at the gaps, and those are high impact items that we are in need of. These are peer reviewed by the Novel editorial committee. And so it goes in your CV as a peer reviewed learning object. You will be excited to know that I have been talking with some of the INOS leadership on creating a INOS collection within the Novel website itself. And that would be an excellent resource for all the ophthalmologists and neurologists in India as well as abroad, because you see cases that we don't. So with that, I will end my talk, and we can move on to the discussion stage of today's symposium. Thank you very much for your attention.
Thank you, Dr. Sachin. That was